My name is Zach Ayers. I'm from Chillicothe, Ohio. So I chose chiropractic because I always was interested in something medical. And once I found out that chiropractors are still portal of entry providers, can take in any patient for any complaint and either refer out or treat based within their diagnostic scope, I found that very interesting, as well as someone who's from a small town that was affected hardly by the opioid crisis. I wanted to be someone that didn't prescribe, but tried to find more conservative methods of treatment. And so chiropractic really just aligned with those things for me. Immediately stepping on campus, it gave me the right feeling. I think the landscape is beautiful. It's kind of tucked away in its own little quiet neighborhood. It's got a lot of great partnerships, like one of which I was very proud of is the Paralympic powerlifting team is housed here at Logan and managed here at Logan. As someone that wants to work with Olympic and high-level athletes, I think that was something that really drew me in. So it just ended up being a good fit. I love it. Wouldn't change my mind ever again. So.
My name is Noel Camello, and I am from Baltimore, Maryland. The big reason why I chose chiropractic is because during my undergrad, I initially wanted to go into physical therapy. Took a little detour when I graduated. I started working in a chiropractic clinic. Really opened my eyes to more possibilities towards chiropractic, and heavily influenced by all the doctors who worked there. They were great people. A lot of them actually graduated at Logan, which kind of took me towards applying to Logan. But yeah, they really just helped me open my eyes, told me there's more possibilities in physical therapy, and I loved working there too. That's another thing. Even if I took the doctors out of the picture, I loved working there. So that helped me come towards here. A lot of the doctors graduated from Logan. 5 of them graduated from Logan. Recent graduates too. So they told me if you want to go to chiropractic, they really recommended Logan. So it's kind of a sign of gratitude for me to apply at Logan. Gratitude for them. One, for opening my eyes to more possibilities, and forgot where I was going after that. But yeah, that's a big reason why I chose Logan, and I love it.
All right, my name is Christopher Daly. I'm a Trimester 5 student, and I'm from St. Louis, Missouri. I first heard about chiropractic my freshman year of college. I didn't know anything about chiropractic, didn't hear the word, didn't know nothing, like just a layman. And so my freshman year of college, I took an intro to exercise science class, and our presentations, we had to do what we wanted to be after college. So if you wanted to be a nurse, if you wanted to be a doctor. And I wanted to be a doctor of osteopathic medicine at first. But then there was this lady that went up to the front of the class and she said, I want to be a chiropractor. And she got to talking about it and what it was. And I was like, oh, that's kind of what, doctors osteopathic medicine does, but without the medication. And so I always kept that profession in the back of my mind because I always wanted to use my hands and I was always good at science. So my sophomore year of college, I ended up changing my major like twice, and I was lost. Didn't know what I wanted to do. Then I went into a season of depression, and out of my depression, I discovered chiropractic, and I was like, hey, let me look more into it. And it brought my spark back up, brought my passion, brought more purpose into my life. And so then I went to one of my mentors, and he told me about chiropractic, and he graduated here from Logan. And he did my first adjustment, and after that, I instantly knew that I wanted to serve in this manner. Like, I felt so good. I felt like Superman. But that's how I found out about chiropractic and about Logan University. And once I got here, I'm actually from St. Louis. So when I got here, everything felt like home. And I just love the profession. I aligned myself with the philosophy, art, and science of chiropractic. And then I went back to my family and I told them about chiropractic, and they didn't really know what it was. They was like, oh, when you crack my back. And I'm like, well, it's more than that, it's deeper than that. And so then I went to my community, went to my friends, went to my colleagues, and they didn't know what chiropractic was. And these are people that look like me, so, and I was like, there's a need that needs to be met in our profession because this profession is so great, it's so valuable. Like, people need chiropractic. You got a spine, you're gonna go see a chiropractor, you know?
Hi, my name is Brianna Leach and I'm from Farmington, Illinois. So the first time I went to the chiropractor was in 7th grade. I played a lot of sports growing up, so I had a lot of just general aches and pains from that. So my parents decided to give it a try. And before that, I thought chiropractic was for old people and people in a lot of bad back pain. But I learned a lot in just that one visit and started forming a relationship with that chiropractor. She kind of took me under her wing and I got to know her all throughout high school. And at age 16, I decided I'm pretty sure this is what I'm supposed to do for the rest of my life. And from there, the decision was made. I started looking into chiropractic schools, and I really liked that we get to take a holistic, natural approach with our patients and help them avoid surgery, opioids, and other things of that nature. And here I am about to graduate and still feeling super confident in my decision of this is what I'm supposed to be doing. I chose Logan because of a lot of their advanced career opportunities that they help you with. So when you get into your later trimesters, like trimester 7, 8, 9, and 10, you start entering student clinic and going out into the community into different types of chiropractic offices. And Logan has a lot of great affiliations when it comes to clinical opportunities. And I knew that I wanted to set myself up for success with my career. And a school that also valued their students having successful careers was really important to me. And that's one of the main reasons why I decided to come to Logan.
My name is Meg Maddox and I am from Michigan. I chose chiropractic because it is the only profession where you walk around every day with what you need, your head and your intellectual abilities, your heart and your compassion in your hands, in order to relieve pain from patients, to increase their mobility and range of motion, and to really improve their quality of life. Logan is unique in the fact that it is a family atmosphere where it is an environment we don't want to leave anybody behind. And so anybody who is willing to put in the effort can be successful here and find a spot that they really thrive in. The faculty are incredibly dedicated to student success. The staff and administration are very open and willing to listen to the concerns of the students. And our general community is very encouraging of us as chiropractic students.
I'm Quinn Wilkes. I'm current trimester 5 student, and I'm from O'Fallon, Illinois. So I chose to pursue chiropractic as a career because I was initially a chiropractic patient down in Arkansas. I lived down there for 7 years. And just as a patient, my first visit, they made such a huge impression on me. And I just knew instantly that I wanted to pursue this, and this is exactly what I wanted to do. In undergrad, I initially wanted to go to medical school, but I just knew ethically that's not what my morals aligned with. I didn't want to do invasive treatment. I didn't want to have to, load people up with antibiotics, drugs, and all that stuff. So I kind of took a different career change, took my time, found chiropractic, and I just fell in love with it instantly. I never did a tour here, but just speaking to the people in admissions over the phone, I just felt so welcome. They made me feel like they valued me as an individual. I didn't feel like I was just another number, another student they were trying to bring into Logan. So I initially called Jeremy and talked to him over the phone, and I actually took a year to decide to come here. But the year later, when I called him, he remembered me, and so I was like, okay, yeah, I need to come here. So that made a huge impression on me too.
My name is Tiffany Williams, and I'm from Carbondale, Illinois. So I chose to pursue a career in chiropractic because my son, when he was born, had fluid in his ears. I was currently at school doing a second massage therapy degree, and one of my instructors was a chiropractor and suggested chiropractic care for his infections, and it completely changed everything. He went from having chronic ear infections to not having any ear infections at all, not needing to get tubes. He slept better, his colic just went away. It was a complete just transformation from what we were dealing with. So that was like the kind of light bulb that was just like, okay, that was not something that was suggested ever. And once we found it, it was just like a miracle. Well, I chose Logan because it's close. I also chose it because being a massage therapist, I worked for several chiropractors that went to Logan, and they knew that it was a good fit for me. When I came to the preview weekend, one of the first instructors I met was Dr. Ridgway, who melted my heart and kind of sealed the deal. So it was just kind of one of those things where I was just guided by people that knew me and knew that it would be a good fit for me, and it turned out to be a great fit.
I'm Delbert Vasquez, and I'm from Ponce, Puerto Rico. My background, it's biomedical science. So I always knew that I wanted to be somewhere in the healthcare profession. But to be honest, when I was close to graduate, I didn't know where I was going to. And Logan held a meeting down there in my hometown in Ponce, Puerto Rico. And so I went there, and I fell in love with the profession. I met Jenna Good, and it was awesome. So I scheduled on visit campus, and it was great. I love the campus. I love how Logan works, how Logan, the opportunities we have here with the masters and all stuff, and the clinic is also awesome. And I think that's it. I'm here now.
Awesome.
And try 7. I am an athlete, and so the person that also talked on the meeting, he was an athlete too, and so he was helped by from a chiropractor, so he avoided surgery. For me, that was awesome, and also so the chance that we have here to do like preceptorship with athletes also in Mizzou or Memphis or all over the places. So opened my eyes that I can stay on the athletic field and do the job, and so it's natural, and I don't know, for me it's great.